Bismillahirrahmanirrahim. Dear students, in this video we will discuss the surgery of the reproductive systems of small animals. So before I can give you the detail of this surgery, there are certain terminologies which are used for the surgery of the reproductive systems, like the ovariohysterectomy, OHE. This is the surgical term which is used for the surgical removal of the ovaries and uterus. Ovurectomy, this is the surgical terminologies or surgical technique which is used for removal of the ovaries alone. Archaectomy, this is the surgical terminology which is used for the removal of the testes. And castration, this is the surgical terminology which is used for removal of the male as well as the female sex organ, and most commonly this terminology is used for males. Mastectomy is the surgical removal of the mammary glands. And episiotomy, this is the surgical technique in which we give the incision at the vulvar orifice to expand the size of the vulva, and this sort of surgery or this sort of operation is recommended whenever we have to explore the vulva and vagina uh, for the removal of the different diseased areas. Similarly, episioplasty, this is the surgical, or vulvoplasty, this is the surgical terminology that is used for reconstruction or reconstructive surgery of the vulva. And usually this episioplasty technique that is used when the vulva and the vagina that is having folds, loose skin folds around, and these loose skin folds usually causing disturbance during the breeding time. Prostatectomy, this is the surgical technique for the removal of the prostate glands alone or some part of the prostate gland that is under the effect of certain diseases. Hysterectomy, this is the surgical terminologies that is used for the removal of incision into the side, incision into the uterus, and this is the terminology that is used interchangeably for C-sections. So, surgery that is indicated for a variety of reasons, and the main important or commonly reason for reproductive surgery, that is the limit the reproduction. And the owner of the animal, they usually want to take the birth control, and they have to offer their animal for surgery just to control the reproduction. Similarly, the reproductive surgery in females that is recommended just to relieve the dystocia, prevent the tumors which are influenced by the androgens or certain reproductive hormones. And similarly, they are also used to control the certain diseases of the reproductive system like pyometra, metritis, prostatitis, and abscess of the prostate glands. And similarly, this is also used for spaying and neutering. This is very commonly used to control the aggressiveness and aggressive behavior of the male dogs and male cats. So the reproductive system diseases, they can be diagnosed by using the different tools, like the on the basis of the history taken from the owner, on the basis of the clinical signs, on the basis of the physical examination, on the basis of diagnostic imagings, and on the basis of radiograph, ultrasonography, lab values like this. So these are the different terminology, these are the different techniques which are useful for making the diagnosis of the different surgical issues or different surgical diseases of the reproductive systems. Uh, so the reproductive, before the reproductive surgeries, both males and females animal, they are physically examine to ascertain the different problems they are having, and just to make the decision before the start of the surgery whether these animals they can be a proper fit or candidate, or whether they may be suffering from certain reproductive problems or not. So physical examination, it includes, in females the physical examination includes the inspection and palpation of the abdominal vulva, abdomen, vulva, and the mammary glands. So the abdominal region that is palpated just to certain the presence of enlarged uterus mass or visceral displacement. And similarly, the pain as a result of the abdominal palpation, that is also noted, and it can show that some disease process that is going on within the abdominal cavity. Similarly, the vulva, that is also examined just to look through the presence of any variation, and to see the presence of any